Hi everyone, my name is Danae Hudson and I'm a professor of psychology at Missouri State University. I was also lucky enough to be part of APA's IPI, so the Introductory Psychology Initiative. I was one of 22 people you can see on the screen there, and we met as a group for 3 years and tried to work on really coming up with some kinds of standards that we can use for introductory psychology. So including new learning outcomes, new examples of assessments for those learning outcomes, integrative themes, and I was part of the course models and design group along with Bridget Martin Hard, Dana Dunn, Robin Musselman, and Erin Richmond. And we now have a book out that is sort of the culmination of all of our work. And my goal for today is to give kind of a mini lecture, something similar to what I would do in my own introductory psychology class. And this one is going to be on stress and health, and just kind of show you how, one option anyway, for weaving in some of the recommendations for IPI. There are many great ways to do this, and this is just some examples and some ideas that maybe you could take with and mold and use that would best fit your teaching style as well. So stress and health. Stress and health has become one of my favorite chapters to discuss in introductory psychology. I think it's so relevant to college students and certainly to all of us in the life that we've been living now for the past almost couple of years. So we're going to look at stress and health from a theoretical perspective, but we're also going to talk today about lots of ways that you can apply this to your own life and start to think too about some of the implications that COVID has had on people and some of the possible future implications this may have for us as well. So this should look familiar to you. We have just completed some of the chapters that would fall under Pillar 1 from this model, and we're going to be jumping over now looking at stress and health, which would really fall under Pillar 5. And so as we talk about this, again, I just want to encourage you, don't think about these topics as individual columns or individual pillars. Let's think about how we can integrate this information with what you already know from the biological chapter, from the neuroscience chapter, from sensation and perception, and the impact that stress and health may have on the body. So keep this in mind as we discuss some of these things as we move through this topic. So just to remind you about some of our learning outcomes for the course. So these should look pretty familiar to you at this point, but what are we really going to be hitting on today? So as we talk about stress and health, let's keep these specifically in mind. We're going to define and explain some basic psychological concepts. We are really going to focus on applying these psychological principles toward personal growth and other aspects of everyday life. So I want you to be able to leave here today and feel like you've learned something about how you might go ahead in the future and manage your own stress. And then also we want to think about drawing logical and objective conclusions about behavior and mental processes from empirical evidence. So keeping in mind that a lot of these recommendations, a lot of what we know about stress and health has been informed by scientific research. And then in terms of our integrative themes, here are the big ones for today. Really, we're going to be looking at the psychological, biological, social, and cultural factors that influence behavior and mental processes. And then again, we're going to apply these psychological principles and think about how they can change our lives and our communities in meaningful ways. So let's just start with some basic definitions. We all certainly have experienced stress. We have a sense of when we're stressed, but really how would we define stress? So stress is really defined as the perceived discrepancy between the physical or psychological demands of a situation and the resources that we have to cope with that. So notice that I said perceived. There really are not a lot of objective measures of stress. We certainly have some physiological measures that we can use to infer stress, but ultimately it falls back to the person to let us know whether or not that is experienced as stress for them. So as a clinical psychologist, I never assume that I know exactly how stressed someone is. I can certainly look at some behavioral observations and make some inferences, but ultimately everybody experiences stress differently, and that's one of the things that we've really seen throughout this pandemic as well, is how the stress affects people and the resources and the way that people cope with that kind of stress. So one thing we know for sure is that a lot of people are experiencing a lot of stress nowadays. And that stress shows itself in different ways for different people. Sometimes it presents itself in very physical ways. Other times it's more psychological in nature. And so as a college student, what are the different categories of stress that you would say are really relevant for college students today? So as we look at some of the literature and some of the things that are written on the internet about categories of stressors for college students, these are ones that sort of consistently appear, and see if you agree with this or not. So first of all, financial stress. And as we're going through these, I also want you to think about how the pandemic that we've been living through maybe has affected or impacted some of these stressors as well. Another one is academic stress, of course. And then relationship stress. So this is pretty broad, but this can include all kinds of relationships. So this is friendships, romantic relationships, relationships with family members, relationships with professors and other students, things like that. And then finally, future stress, also a really big one. So this is kind of the, what am I doing with my life? Is this all going to be worth it? Am I going to be able to pay off my loans kind of stress? And as I mentioned earlier, stress is expressed for people in different ways, and there are actually a number of different both physical and psychological symptoms that we can have that indicate to us that we're stressed. So, for example, if we look at some of the physical symptoms, there's a lot of them: muscle tension, irritable bowel symptoms, headaches, insomnia, fatigue, TMJ, so clenching or grinding teeth, and changes in appetite or weight. And then along with that, there might be a number of psychological symptoms that people experience. So feeling overwhelmed, being less patient with others, more pessimistic, feeling sad or depressed or lonely, having less motivation to actually do things, impaired concentration, and really feeling a lot of worry and anxiety. And in a recent study that was published last year, researchers found from a meta-analysis that included over 9,000 participants that rates of depression were actually 33.7%. So think about that. That's more than 1 out of every 3 people is living with symptoms of depression, and rates of anxiety were 31.9%. So that is really high. And this data is very typical, actually, of what we've seen. If we look at the pandemic itself, there was a smaller study that included 195 college students. And at that time, and so this is in the middle of the pandemic, 71% of them indicated that they were experiencing stress and anxiety related to COVID. So again, now we're getting up to about 3/4 of people are experiencing high levels of stress or anxiety. And so it can be tricky to measure exactly how stressed people are. And luckily, we actually have some data from the American Psychological Association that's been collected every year since 2007 to be able to give us some information about that. So here's some information from that report from the American Psychological Association. This is the Stress in America from 2020. And what I want to draw your attention to in this report is really one of the conclusions that they made based off of all of the data that they collected. So I want to point this out. What they say is we're facing a national mental health crisis that could yield serious health effects and social consequences for years to come. So back in 2020, psychologists were calling out this is a really vulnerable time for people for various reasons, including the pandemic, and that we need to do something about this because we're going to be in a really difficult situation soon. And if you look at the most recent Stress in America report from 2021, so this was just released a few months ago, and here are some interesting results from that report. So if you look down at the last bullet point first, is you're seeing nearly half of parents said that their level of stress has increased compared with before the pandemic. I think we can think of lots of reasons for that. Nearly half of Americans have delayed or canceled healthcare services. So here we're starting to see some of the effects of stress 2 out of 3 Americans said they were sleeping more or less than what they wanted to since the pandemic started. And one of the big factors that has come out is the majority of adults, 61%, have reported undesired weight changes since the start of the pandemic. And really what that's talking about is people primarily reporting weight gain. So there are a lot of different ways that we're starting to see the effects of stress and the stress from the pandemic. And the difficulty, of course, is that we know that stress can lead people to getting sick. And of course, being sick is really stressful. And so then that can lead to more stress. And so we're in a bit of a catch-22 in this situation. So how does stress actually make us sick? So there's a really interesting subfield that includes psychology called psychoneuroimmunology. So it emphasizes the interaction of psychological, neurological, and endocrine and immunological processes in stress and illness. So this is how we know our immune system works. So we have 3 types of white blood cells called lymphocytes, and these are the B cells, the T cells, and the NK cells, and they all have really important roles to play in trying to keep us healthy. And so what happens during periods of stress is that the stress hormones, including cortisol, they suppress these disease-fighting activities of the lymphocytes. And so that actually puts us at risk for actually catching different illnesses and things like that. So we know that stress not only makes us feel bad, but it can actually set us up to become physically sick as well. And so let's switch gears a little bit and talk about what can we do about this. So what are some things that you can take from this discussion and implement in your own life? So again, thinking about how we can apply this content from psychology in meaningful ways that will be helpful to you regardless of whatever you go on to major in. And you may never take another psychology class again, but hopefully you'll remember some of these strategies and they can help you throughout your life. So when we talk about managing stress, we can really separate those strategies into 2 categories. So the physiological strategies, and then there are psychological strategies as well. I want to talk most about the physiological strategies, and you can read about the psychological strategies in your book. So physiological strategies are kind of what they sound like. It's a way, there are some things that we can do to kind of bring down our overall level of stress. So when you think back to a time that you've been really stressed, we often hold that stress in our body as well. So we have a lot of muscle tension, and we usually don't recognize that until we actually are able to relax, and then we kind of feel like, oh, I didn't realize how stressed I was. And so some of these physiological strategies can help with that. They're not going to take away the thing that's causing the stress, but they are going to help you kind of bring the physiological effects of stress down just a little bit. And sometimes when we can do that, it puts us in a position to better be able to employ some of the psychological strategies that actually help us deal with the stress. So what are these physiological strategies? So first of all, there's something called biofeedback or neurofeedback. So this is basically where you get connected to some kind of machine or some kind of instrument that will give you feedback about your physiological response. And so in the case of neurofeedback, it can actually be like brain waves. In biofeedback, it can look at things like heart rate, blood pressure, and this has been used for a long time in health psychology and actually teaching people how to manage their own blood pressure and things like that. I have this picture that I put in this slide. This is from a few years ago. These are my daughters when we were in Nashville and at the Science Museum, and this was a game that they were playing called Mind Ball, and it was really cool where they actually wore these they were connected to these little bands around their head that were actually monitoring their brain waves and in using that as an indicator of relaxation. And so the more relaxed they were, the more the ball moved toward the other person. And so then they won if they were able to move that little ball all the way over to the other side. And it was really interesting. You can see my one daughter, she's got her her fingers in her ears. She's trying to block out all the external stimulation. My other daughter looks like she's maybe thinking about one of the best vacations that we ever had. And it was neat to see them, even at a young age, being able to get a sense of what did they need to do with their mind and body to get them to a place where they could relax. So they really enjoyed that. So there's a lot of really accessible ways for people now to be able to learn how to and engage in biofeedback kinds of activities. Another thing is progressive muscle relaxation. So this has been around for a long time. This is really good for people who tend to carry their stress in their muscles. So if you notice that you're a person, when you're stressed, you tend to have your shoulders up by your ears and you don't even realize it, progressive muscle relaxation may be good for you. So this is what it sounds like. So basically you physically relax by tensing and releasing different muscle groups. So you may want to try this as well. So you would first say, maybe start in your hands, and you would have a period of time where you make a fist really, really, really tight, and you focus on what that feels like. So you focus on the sensation of that tightness, and you squeeze as hard as you can, and then you completely relax. And when you completely relax, you really pay attention to and focus on the difference in that kind of feeling that you experience. So with your hands, you might be able to feel kind of a rush of warmth that goes through your hands, and then you do the same thing with different body parts, and you would go all the way from your feet all the way up toward your head, and then maybe in the end, at the very end, you might do your entire body at once. And there are lots of things on the internet that you can find that are free, that are guided progressive muscle relaxation. So you can actually just turn that on, go along with it. It might be 10 minutes, it might be 20 minutes, and it can really help a person to physically relax. Another thing that I'm calling physiological, although it doesn't have the same kind of physical relaxation, it's more, I would say, mental relaxation, is guided imagery or meditation. So there have been lots of studies to show the impact that daily meditation practice can have on people's lives. And it doesn't have to be daily. It could just start, if you start really, really small. There are some great apps out there nowadays. There are lots of things online that you can access for free that are little guided imageries or meditation practices. And so this is a way of kind of, again, think about it as that same kind of physical relaxation, but it's really for your mind. And then the last one that a lot of times people don't think about, but is exercise. So exercise, I would say, is sort of a combination of both the physical, but also the psychological, the mental part as well. Because a lot of time when people are exercising, that is a chance for them to kind of almost go into a meditative state for a part of that. So there are lots of benefits of exercise, physiologically, psychologically as well. It's one of the most potent treatments we have for mild to moderate depression. So certainly what we know tends to happen is when people are stressed, exercise is one of the first things to go, right? So your life is like, I've got too much to do. I don't actually have any time for this, so I'm not going to go to the gym tonight, or I'm not going to do my exercises. And really, that's exactly the wrong thing to do. So we need to think about in our life, what are some other things that we can cut out so we can really kind of maintain that exercise regimen, because it's really going to help us deal with the physiological effects of that stress that we're experiencing. So as we start to wrap up, let's go back to a couple of our integrative themes and think about how it applies to what we've talked about today. So think about in your own life, what are some of the psychological, biological, socio-cultural, so social or cultural factors that influence your experience of stress and also your ability to deal with stress. So everybody has a different reaction to stress, and a lot of times that stems from their family environment. So how is stress communicated in your family? Some families are kind of more of the, I don't really want to hear about it, I don't want to talk about it, that if you're actually really stressed, maybe it's viewed as a sign of weakness. Whereas other families or friend groups might actually use stress as a badge of honor. So the more stressed you are, it sort of implies that you're more productive, that you're more successful. And so in that sense, you can see that sometimes people have some beliefs about stress that may actually influence how and the impact that stress has in their life. So even though they say that they don't want to be as stressed, when in fact maybe that stress is serving some kind of function for them. And so those would be important things to explore. For example, if I had someone in therapy who was really stressed, as I would want to talk about what are some of those psychological factors that might be going on for them. And then finally, applying these psychological principles can change our lives in positive ways. So hopefully at the end of this, you can think about some of the ways that you have been handling stress, or maybe some of the things that cause you stress, and maybe you have some ideas now about some things that you could do in the future that would maybe help to reduce the stress that you have. And that's something that you can take with you throughout your entire life. So talking instructor to instructor here now, there are many ways I think that you could go about assessing this content, informative kind of ways. So, and that really is going to vary depending on the size of your classes, how your classes are set up. Do you have any help for grading, things like that? So there's going to be a lot of variability there, but I wanted to give you just a couple of ideas. So if you have a small to kind of medium-sized class and you want to focus a little bit on writing, you could have students write a paragraph and discuss something that they learned from this class and how it illustrates one or more of the integrative themes of introductory psychology. So I would do this orally. I have very large classes, so I wouldn't have students write this, but I would often have discussions in my classes with students about what theme did you see in the things that we talked about today, and how would that apply? And so I specifically pointed out a few themes, but that doesn't mean that other ones aren't relevant as well. So I really think it's important to have students reflect on these and start to see that these themes actually flow through all different chapters, all different content. And that really helps them to see psychology as a whole, rather than a series of 12 or 16 individual chapters. So I think that's one thing you could do. I think you could ask a more specific question that would actually kind of pull out some content related things, if that's one of the things that you're interested in assessing, is their level of understanding or knowledge of the content. So it might be a question like, why do so many students get sick at the end of the semester after final exams? What advice would you give students to help them to stay healthy after the semester ends? So that would be an interesting prompt for them. And that might even be something that you could do in a discussion board if it was an online class. I think if you have a large class, you might want to just have some formative multiple choice assessment questions. I'll write a few of these and then you should be able to access them on the IPI website that goes along with this lecture. And I may even be able to put a short video up there, an example of what I might show in one of my classes about stress and health too. So I usually incorporate a lot of videos and a lot of other kinds of visual aids just as a way of kind of bringing this content to life. So thank you for this opportunity. I hope this has been helpful for you. I'm happy to talk to anybody who has any questions about this or the IPI in general, and I wish you the best of luck in incorporating this information into your intro psych classes.